Hello everyone, I am Dr. Vaibhav Kubal. I am a pulmonologist working at S L Raheja Fortis Associate Hospital, and today we are here to talk about a basic necessity of life, that is clean air. We all know in every winter seasons we tackle a very huge problem of air pollution. We are always taught to think about food, shelter and clothing as a basic necessity of our life. But we never talk about clean air and clean water. Possibly we do not have to pay for it, and that's the reason why we don't think about it. But God forbidden, there should not be a situation where we need to buy clean air and clean water, because that would be the most expensive basic necessity where we are heading towards. Being a respiratory physician, we see a lot of patients with cough, breathlessness and other chronic respiratory problems. And during these winter seasons, we see a surge of these patients coming in with these complaints. And possibly environmental pollution is playing a role in this. Now, what are the common symptoms that usually the patients encounter? That can be local side effects or short-lived side effects, or it could be a long-term side effects. In short-term side effects, patient may experience irritation of eyes, throat, they may have watering eyes, a cough predominantly dry or mucus associated, not responding to local medications. This is usually because of the irritants and pollutants which are present in the air, which actually irritates the mucosa of the airways as well as the lungs. On a long-term, side effects of such kind of pollutants can also lead to deadly diseases like lung cancers, heart attacks and so on so forward. Now, I'm sure the civic authorities are taking the note of these increased pollutant levels in the air during these levels, and they are taking the necessary steps. But how at our individual levels can we address this issue? Well, I think we need, as on any rainy day or a heavy rainy day we have red alerts. I think with a higher AQI day or a bad day, we should avoid our outdoor activities. Most probably in the morning, exercise activities and evening exercise activities should be avoided during these times of the days. Also, if your job is into an outdoor activity like a sales or any other outdoor activity jobs, you should be confined to using a mask. Now, masks, as we know, that are available in various types, but the best mask available which can help you protect is the N95 mask. People who have respiratory problems are the biggest affected population amongst this, because they are already tackling with a chronic respiratory problem. On top of it, the pollutants and the air pollution adds on to it, leading to respiratory distress, acute exacerbations and also hospitalizations. They usually come to our OPDs with increased symptoms, especially even after being on medicines regularly. So what can they do in such cases? One is that they have to adhere to their medications, because if the patient who is on medications usually are able to fight these irritants and pollutants in a better way than a patients who are not on this. To some extent, it might also prevent a hospitalization. The second thing is they should not wait for a long time if they are experiencing any increased symptoms. Any increased symptoms for 1 or 2 days, they should immediately try to address and come to a medical help or visit the pulmonologist to talk to them about their problems. Let the pulmonologist understand their warning signals and accordingly start the treatment even before it is worsening. The third and the important part is the lung health, which is the vaccination. Vaccination is something which every patient of chronic lung disease should be done. Normally, it is influenza and pneumococcal vaccines that we usually offer, but there are other vaccinations also which can be useful. So, I hope you find this video useful, and if there are any queries which you want to address, we at Raheja Hospital are happy to help you here. Thank you.